Pull it till the tissue resistance. So grade 1 is just the skin, and then I feel that blocking, right? And before that, it's gonna be the 2. So you're gonna feel that as the 1 or 2. So you don't need to pull their arm too far, like this way, to actually perform the joint play. It's simple. And then you can perform some posterior and then the anterior glide too, right? So depending on the size difference between the therapist and then the body, sometimes I have to place their hand on their body to do it, or if it is more smaller body, then I can actually hold it and then try the posterior glide and then the anterior glide, because this is the better way to relax the joint because of the relaxed position for the GH joint. So you could feel better when you are putting into that position. But sometimes when it's too heavy, so then I don't have choice, so I have to place it here and then perform the joint play to actually feel it. So grade 1 is gonna be simple like this one. And then when I feel the tissue stretch like this, is grade 3, right? So then I'm gonna back off a little bit so I can feel the grade 2. But through the experience, you can tell that how much is the grade 2. And then the anterior glide 2, usually you need to flip your patient over to perform the joint mobilization technique, but as a joint play, you don't have to because it's just 1 and 2. So you can hold the humeral head and then push anteriorly. So then this time it's gonna be easier to hold their arm weight to actually push anteriorly to feel it. Otherwise, it's gonna be too hard to feel it like this way, right? Because it's kind of making the angular motion of the joint.
Do you think we can place our hand onto the scapula and push it down in the treatment, like and stuff? Because we were told to place your hand on the
So
scapular.
usually, like you need to stabilize the proximal joint, and then you're gonna move the distal part of the joint to make it effective. So either way, it's fine. You can hold down onto it or place your hand there to support that one, and then push it. It's depending on your comfortable level of the stabilization there. And then then the lateral gap is same thing too, right? You're gonna place your hand on here and then try to feel the gapping, right? So you can check those ones, then it's gonna be enough. You don't need to do full set of the things. So long axis, lateral gap maybe, and then the anterior posterior glide, then it should be fine, right? And then, so you can perform some joint mobilization at the AC joint. So where is the AC joint is important, right? If you are confused of always checking with the where is the acromion, right? And then where is the clavicle end. And when you find those 2 points, you can definitely find the where is the line. So when you are trying to do the friction, then the fiber of the joint is like this way, right? Crossing the joint. So then now you're gonna go along the joint line to actually perform the friction, right? If you decide to do so. And then you can do some joint mobilization for that site. So you can focusing on the AC joint only, or you can opening up from the SC and then the AC too, because with this compression injury, usually that's how they injure, right? So fall onto the tip of their shoulder. So then it's not only compressed here and here too. So you can cupping up the SC joint. You're gonna cupping on between your hyper and hypothenar area, and then clavicle and the medial end is goes like that way, right? And then you're gonna cupping onto here, and then you wanna try to push out like along the line, and then you can sustain glide out the this way, or like you can opening up this side too, so you can hold down onto the lateral side of the clavicle. So it's gonna be a little bit painful for your patient because you're gonna hook the clavicle onto it. So when it's slippery, it's harder. So like you need to use the sheet over the clavicle to hold down onto it, because he's wearing the t-shirt, it's easy to hold down with it. And then this hand is gonna be cupping the acromion here, and you're gonna try to open up.
Distracting it?
Yeah, distraction. And you can also perform the anterior and posterior glide of it. So you can hold down the same thing and then stabilize the acromion, and then you can glide anteriorly like pulling like this, or pushing it. But usually posterior glide is not necessary for most of the patient. Usually what you need to do is more the anterior glide to opening up, especially like, you know, those TOS syndrome, even if they have the issue with the thigh muscles, then you may need to open up that area too. So you can use that technique, but it is painful. So during the exam, I may not do it because I don't want to try any discomfort on the body when they don't have any symptoms. So I may try some distraction, but not like really moving around their clavicle a lot. Okay?
So I got a question. I didn't saw like you by doing the GH like anterior glide.
Anterior
So
glide.
where like the proximal area you want to stabilize? You stabilize
Like
the distal
you know,
part?
because of the weight of the arm to glide anteriorly better,
Yeah.
I'm not really stabilizing here.
Yeah.
But usually with the anterior glide, it's easy to move their head easier because there's a more like lacking space there
Okay.
than the posterior.
So the trunk is moved together, but still we can feel that, right?
Yeah, or like you can, if you wanna actually stabilize it,